Hi, I'm Dr. Karen Reluccio, Public Health Officer and Deputy Director of the Napa County Health and Human Services Agency. Thank you for joining us for our January 2022 COVID-19 update. First, I would like to acknowledge that this is a dynamic time in our response to the pandemic. And I would like to thank all of our Napa County residents who have done all that they can in order to keep our community safe through this challenging and uncertain time. Today, we will be discussing case updates, new guidelines from the California Department of Public Health about what to do if you test positive or have been exposed to someone who has COVID-19, as well as answering some of the most commonly asked questions we're hearing from the public. In recent weeks, we have seen a sharp increase in cases and the trend continues upwards. This week marks an 88% increase from last week, and it continues to increase. This recent surge is presumably driven by the highly contagious Omicron variant and the resumption of gathering and traveling around the holiday season. We are seeing more cases now than we were during last winter's surge, which was our previous peak throughout this pandemic. This high number of cases is impacting businesses and essential services like healthcare and schools, as many Napa County students prepare for return to in-person instruction. The Omicron variant has led to a statewide indoor masking mandate that was put in place in mid-December. As of yesterday, this masking mandate will now be extended to February 15th. Despite these challenges, there is good news and a reason to be hopeful as we face this surge. While the capacity of our healthcare system is strained due to staffing shortages, we are seeing lower COVID-19 hospitalizations than we did from previous surges. Several studies have now shown the Omicron variant, while highly contagious, often results in milder symptoms, such as cold symptoms. We also have a highly vaccinated community right now, and that offers strong protection against serious illness. Over 72% of our entire population is vaccinated, and I'm really hopeful we'll get to 80% in the coming weeks and months. The COVID-19 vaccine is 76% effective against the Omicron variant, and getting boosted, if you are eligible, is an important way to protect yourself. Right now, 47% of our eligible Napa County residents are boosted. Another important development is the approval and availability of COVID-19 treatment options. If you've tested positive for COVID-19, talk with your doctor about whether COVID-19 treatment options, such as monoclonal antibodies or antiviral medicines, might be right for you. Our website, www.countyofnapa.org, is a great resource if you're looking for more information about vaccinations, treatment, or what to do if you test positive. There are a lot of questions about what to do if you're exposed to COVID-19 or test positive. And there's new guidance from both the CDC and the California Department of Public Health in this area. There are differences between the guidance from CDC and CDPH. And at this time, Napa County is following the guidance from the state, from the California Department of Public Health. Let's talk through the CDPH guidance, scenario by scenario, and you can find the full guidance document on our website. I should note here as well that this guidance is applicable to the general public, and there is a different set of guidelines that is applicable to healthcare personnel. So the first scenario is what happens if you test positive for COVID-19? Well, first of all, don't panic. It's normal to feel scared. And if you need guidance about your symptoms or risks, talk to your doctor. According to the California Department of Public Health guidance, regardless of your vaccination status, previous infection, or lack of symptoms, if you test positive for COVID-19 with a lab test or an at-home test, you need to follow the isolation recommendations. Those recommendations are to stay home and isolate for at least 5 days. You can end your isolation after 5 days if you meet two conditions. If you don't have any symptoms or your symptoms are resolving, and you have had a negative test on day 5 or later. If your isolation ends after 5 days, CDPH recommends that you continue to wear your mask when you're around others from day 5 to 10. If you don't have symptoms, but you're unable to test or choose not to test, your isolation can end after day 10. If you have symptoms such as a fever, you should continue to isolate until your fever resolves. Now, let's talk about what happens if you are exposed to someone with COVID-19. If that happens, if you're around someone who has tested positive for COVID-19, you will follow the CDPH quarantine guidelines. Those guidelines differ depending on your vaccination status. So let's first talk about quarantine scenario 1. You have been exposed to someone with COVID-19 and you are unvaccinated, or else you are vaccinated, but you're eligible for a booster, but you haven't gotten one yet. CDPH recommends you stay home for at least 5 days after your last contact with a person who has COVID-19. You are asked to get tested on day 5. If you test negative on day 5 and you don't have any symptoms, your quarantine can end. You should continue to wear a mask around others for a total of 10 days. If you test positive or you have symptoms that develop, follow the isolation guidelines that we just described. Okay, now let's talk through quarantine scenario 2. So you're exposed to someone with COVID-19 and you are someone who is boosted, or else you're vaccinated but not yet eligible for a booster. So according to CDPH guidance, you do not need to stay home or quarantine in any way, but they do recommend that you wear a well-fitting mask around others for 10 days and get tested on day 5. If you test positive, follow the isolation recommendations we just talked about, and if symptoms develop, you will want to test and stay home. Guidance evolves as we learn more during the course of this pandemic and as new challenges arise. We keep our website updated with the latest guidance documents, and we're happy to answer your questions at coronavirus@countyofnapa.org. Now, let's get to some questions that we're seeing a lot in our coronavirus inbox. First, what can I do to protect myself from COVID during the surge of cases? First, get vaccinated, and if eligible, get a booster shot. Number 2, upgrade your mask to a double mask, a surgical mask, or an N95 or other respirator. The third way that you can protect yourself is to do your activities outdoors, and if you can't, increase ventilation by opening doors and windows. Get tested before and after travel and gatherings, and understand your treatment options, which are posted on our website, and talk to your doctor about these options. The next question, how is this surge different from others we've seen? How is Omicron different from other variants? First of all, Omicron has a lot more mutations, and these mutations can impact immune response and response to treatment and vaccinations. However, Omicron causes milder infection as the virus does not go into the lungs as much as the other variants and regular COVID-19. If we look at what we're experiencing with our surge and our case counts, we have exceeded last winter's surge, with our current case counts double of what we saw last winter and nearly 3 times the number of cases as the Delta surge. Fortunately, hospitalizations from COVID are lower, but demands on staffing across healthcare is high due to healthcare workers being infected with COVID-19. And in general, there are more hospitalizations in the winter from other diagnoses. We urge vigilance and caution to protect our healthcare system. Am I protected from Omicron if I'm fully vaccinated? So now, fully vaccinated does not necessarily mean you're fully protected anymore. Boosters help broaden and strengthen the protection against Omicron. The Food and Drug Administration and CDC has expanded eligibility. Now, people aged 12 years of age or older are eligible for booster shots. While adults can choose to receive any vaccine product for their booster dose, the mRNA COVID-19 vaccines are preferred over the Johnson & Johnson vaccine for boosters. Boosters are especially urgent for those at higher risk of severe disease, such as persons residing in nursing homes and long-term care facilities. How can I get a test right now? What do I do if I have symptoms and cannot get a test? There is a surge in demand at testing locations across California. However, we do have increased capacity at the OptumServe sites and hope to see appointments become more available across sites. I think it's important at this time to check retail providers for at-home tests and to order online for later in the month. If you are symptomatic and cannot get a test, assume you are positive and stay home following the California Department of Public Health guidance. Once again, Omicron is very, very similar to cold symptoms, and it's hard to know the difference. So it is better for you to stay home and not expose others if you have a cold symptom and you cannot get tested.